Okay, welcome everybody. Thanks for joining us today on this call. Our call today is with several local physicians through our different regions, including KFL&A Public Health Region, Leeds, Grenville and Lanark Public Health, as well as Hastings, Prince Edward County Public Health. Today we've been joined by local MOHs and other physicians in all the different areas, which is excellent. Thank you so much for coming together. And we have several questions today about the COVID-19 vaccine. We've had many questions from the public, and we're very happy to have you all here to help answer some of those very important questions. Thank you. We're going to start with Dr. Hatley. Hello, Dr. Hatley. Our first question is, why get vaccinated?
That is a very good question. And I think the bottom line is to avoid getting COVID-19. So many people with COVID-19 only have a mild illness, but some of us actually become very ill, and a small percentage of us will unfortunately die. And you know, there is actually no way to know how sick COVID-19 is going to make you, even if you don't have the risk factors such as diabetes, hypertension, obesity, or being of the age of wisdom. The vaccine stimulates our immune system like having the virus would, except you don't have to get the virus or the illness associated with it. Our bodies produce antibodies, and this allows us to fight the virus if any of it inadvertently gets into our system when someone around us sneezes or coughs, or maybe when we're just in an environment where the virus has been. So I recommend everyone get their vaccination who qualifies for it.
Thank you, Dr. Hatley. Our next question is for Dr. Kniff. Hello, Dr. Kniff, how are you?
I'm very good today. Yourself?
I'm great, thank you. How do mRNA vaccines, like COVID-19 vaccine, work?
Well, mRNA vaccines are relatively new. It's really actually pretty interesting. They've been working on this technology for quite a number of years. It's been used more in veterinary fields, but this is really the first of its kind. These two vaccines that have come out are the first of the kind in humans. And so the way these vaccines work is our bodies make mRNA. So mRNA is a type of code in our cells that tells our cells how to make protein. It sort of gives the template for making protein. And so what these vaccines do is they take mRNA that codes for a virus protein. So the COVID virus is covered with this protein called a spike protein. It's the protein on the virus that attaches to our cells and comes in and infects us. And so what they have done is they've coded for this protein, this spike protein from the virus, into mRNA, and then they inject, the vaccine gets injected into us. The mRNA goes into our cells, and our cells, our own cells, make this viral spike protein. So then what happens is that our immune system recognizes that this new protein, this spike protein from the virus, is foreign. It's not part of us, and it mounts a response. Our immune system mounts this response against this invader protein, you could say, and then it helps us fight off the vaccine, or fight off the virus. And so the benefit of that is that if and when down the road we become infected with COVID-19, then our immune system is already ready to go. It recognizes that this is a foreign substance, a foreign protein, and it's ready to mount the fight and fight off the virus before we get sick. And so it's a really interesting way to deliver a vaccine by coding this protein, this spike protein, into the vaccine. So there's two companies that have developed these vaccines, Pfizer-BioNTech and Moderna, both of which have been approved in Canada, and both of which are actually being injected now for people. And it's a really exciting way. They seem to be very effective so far, and it's generated a lot of excitement.
Can an mRNA vaccine alter a person's DNA?
So there's been a bit of chatter about that recently. The answer is no. The vaccine cannot, the mRNA from the vaccine cannot enter our own DNA. So our DNA lives in the part of our cells. In every one of our cells, we have our DNA stored in the nucleus. The nucleus is an area deep inside each of our cells, and that's where our DNA is kept. mRNA does its work way out in the periphery of the cell, away from the nucleus. And so when we are injected with this vaccine and the mRNA and the viral mRNA enters our cells, it doesn't go anywhere near our nucleus, doesn't go anywhere near our DNA, and it cannot get integrated into our own DNA or our own genome. It's just not possible. So there is nothing to be concerned about with that regard.
Thanks very much, Dr. Caniff.
Welcome.
Our next question from the public is for Dr. Pincock. Hello, Dr. Pincock, how are you?
Hi, I'm very well, thanks. How are you?
Very good, thank you. Can the COVID-19 vaccine cause COVID-19 infection?
So the answer to that question is no. None of the COVID-19 vaccines that are currently under development or are approved for use in Canada are able to cause COVID-19 infection. The reason for that is because none of these vaccines contain any live COVID-19 virus. So the vaccines that are approved for use in Canada use either mRNA, like the Moderna or the Pfizer-BioNTech vaccines, or else other vaccines that are under development but not yet approved use bits of digested or degraded virus that, again, are not capable of causing a COVID-19 infection in a person. The analogy that was told to me about these things causing a virus, it would be like trying to grow a chicken from a scrambled egg. It's just not something that's going to be possible. The goal of all of these vaccines is to give our immune system something that it can recognize and prepare a defense for, so that if we do encounter the actual live COVID-19 virus in the community or in the environment somewhere, that we have a defense prepared already for it and that it cannot cause infection in us. The process of arming our immune system, when our immune system turns on, sometimes does cause symptoms that would mimic a COVID-19 infection, and the main one is fever. When our immune system is turned on, one of the first things our body can do to defend itself is start raising its temperature and causing a fever. When our immune system is turned on because of a vaccine, it does the same thing. So some people will have a fever when they first receive a vaccine, but that is not the same as a COVID-19 infection.
Thank you, Dr. Pincock. Our next question is for Dr. Stewart. Once a person is fully vaccinated, can they stop following public health measures like wearing a mask or physical distancing and self-isolating when they become sick?
Yeah, really good question. Unfortunately, you have to keep on with all those precautions. The research that was done with the new COVID vaccine looked at whether or not symptoms were prevented by taking the vaccine, and they did a really good job. 95% of people didn't get sick with COVID. They didn't measure whether the virus actually was prevented from multiplying in the back of your nose and throat. And if that can still happen, then it means that if you are exposed to the virus, that you could still be multiplying the virus in the back of your nose and could still infect someone else. So that you want to make sure that doesn't happen. It may be that over time we discover that the antibody response that the vaccine gives you is going to be so good that the minute the virus lands in the back of your nose or throat, it quickly gets rid of it, so you could not give it to anyone else. Until we reach that point, it's really important to follow all the COVID precautions.
Thank you. Our next question is for Dr. Ferreira. Hi, Dr. Ferreira. How are you?
I'm great. Thank you very much for having me today.
Thank you for joining us. Our question from the public for you is, can people with severe allergies to a component of the COVID-19 vaccine receive the vaccine?
Thank you. That's an excellent question, especially in light of the fact that early on in vaccine rollout, the news media picked up on some severe reactions out of the UK. In light of this and the current research, the answer is simply no. People with a history of severe allergic reaction to any component of the COVID vaccine or its container should not receive the vaccine. Most of the ingredients are, however, known to not be associated with severe immediate allergic reactions. That being said, there's one ingredient called polyethylene glycol, or PEG, as it's more colloquially known as, is able to cause some severe reactions in very rare cases. PEG is in fact found in bowel preparations for colonoscopies, some laxatives, over-the-counter cough syrups, cosmetics, skincare products, and some food and drinks. For those individuals that remain concerned about the risk of having an allergic reaction, there is a complete list of the ingredients of the vaccine on the Health Canada website.
Thanks. And I also have a follow-up question for you, Dr. Ferreira. Can people with severe allergies to other vaccines, medicines, or foods receive the COVID-19 vaccine?
Thank you. This is actually a really good question, and one that I've already had to review with some patients earlier this week. The answer is yes, people with allergic reactions to other vaccines and medicines can in fact get the COVID vaccine. Currently, only those individuals with a history of severe allergic reaction to any component of the vaccine itself or its container are not advised to receive the COVID-19 vaccine because of the potential severe allergic reactions. That would probably amount to a very small number of people. However, that being said, as we're in the early stages of vaccine rollout, there may be some exclusions of people with a history of severe allergies to other vaccines, medicines, or foods. And we'd ask that people be patient as we figure things out with the initial rollout of these vaccines. Of course, this is being done at an abundance of precaution and for individual safety measures.
Thank you, Dr. Ferreira. I have another question for Dr. Pincock. If a person develops an adverse reaction to a vaccine, what should they do?
Well, thanks. That's a great question. So if somebody experiences an adverse effect to a vaccine, it could take a lot of different forms. It could be very commonly a bit of a sore arm or maybe a fever. But sometimes there are more serious reactions that occur. In rare cases, people can get a serious allergic reaction called anaphylaxis, where they might have hives or swelling of their face or difficulty breathing, and that requires immediate medical attention. But that also usually happens fairly quickly and often very shortly after a vaccine is administered. So people are often in a vaccination center and close to help if that happens. If people have other adverse effects, the person to probably talk to about that would be somebody like their family doctor. Healthcare providers are going to report side effects directly to public health units in Ontario, and the public health units are going to keep track of and further those reports to the vaccine manufacturers and other government agencies to keep track of them. If our guidance needs to be adjusted based on people's reactions during the vaccine rollout, then we will continue to communicate those changes as they occur.
Thank you, Dr. Pincock. Our next question is for Dr. Hatley. What are the side effects of the COVID-19 vaccine?
I think this is a question that everyone has. And given that we expect the vast majority of Canadians are going to get this vaccine, then they'll want to know what they can expect to experience. So most side effects are mild and will go away within a couple of days, 2 to 3 days. In order of frequency, it's pain at the injection site. So for most of us, that would be a sore shoulder for a day or two. Next is fatigue. About half the people who get this vaccine will get a headache. About a third of us, muscle pains. A third of us will get also chills, joint pain, and fever. That's with the first shot. You're more likely to get fever with the second shot than with the first shot. As you'll recall, there are 2 doses that most of us will get. So typically the symptoms, the side effects of the vaccine are quite mild, and they resolve again on their own. They're expected to occur with a vaccination, and it's because the vaccine stimulates our immune system. That is the intention of the vaccine. And these side effects, they're actually the features of an immune response. So we're all familiar with this from when we've gotten other viruses. These are typical symptoms. The beauty of these symptoms is that they're not actually associated with a true infection, and they go away more quickly than one would expect with the vast majority of true viral infections. So I think we can be encouraged that we're not going to suffer a lot in getting this vaccine. It'll be similar to what most of us experience with the flu shot. There was one study that looked at a large number of people in the range of 1 million, and reported side effects were in the range of hundreds. So you can see that not a lot of people are overly upset by getting this vaccine due to the adverse effects.
Thank you, Dr. Hatley. Our next question is for Dr. Stewart. Dr. Stewart, can COVID-19 vaccine cause a false positive COVID-19 viral test?
Yeah, another good question. The answer is no, because the PCR test that the lab uses to see whether or not you have COVID virus in the back of your nose and throat is a totally different test than the antibody levels that you're going to be developing when you had the vaccine. So they're not related at all, so that you don't have any worry that because you've been immunized, that when they do that swab in the back of your nose and throat, it might pick it up. It will not. When we get to the point that we're starting to do more antibody testing of people, then it may pick up the antibodies that your body has developed. But for now, the two are totally different, and so you don't need to worry about getting a positive COVID test if you've been immunized. They're totally separate.
Thank you very much, Dr. Stewart. Our next question is for Dr. Ogleza. Hello, Dr. Ogleza. How are you today?
Very well, thank you. How about you?
I am great, thank you. Are there any other precautions with receiving the vaccine?
It's a very good question. The main thing that we advise people with regards to any vaccine is that we advise that people defer vaccination if they have acute febrile illness. So basically, if someone has a fever, they should come back, wait, and get the vaccine once they recover from that, when they are no longer febrile. And again, this is not so much that the vaccine will hurt them or anything bad will happen, but we have to realize that fever, or if they have fever for other reasons, their immune system might be already activated, and they will not respond appropriately to the vaccine, and they may not develop the same level of protection that they would have gotten otherwise. So that's why we ask them to wait until they're no longer febrile. Now, during the times of pandemic and COVID-19 specifically, we also ask people who have any other mild symptoms to wait until they feel better. And again, if any of these symptoms could be from COVID and are in fact from COVID, we really want to make sure that these individuals do not come to the settings where we give immunizations. So we protect those other individuals who are coming to get the vaccine from getting exposed to a virus. Another precaution, and again, more of a theoretical nature, is that we have to realize that there might be certain groups of people with certain conditions that were excluded from trials. And as such, we don't have exactly the information to how they would respond to the vaccine. And again, those individuals may need to talk to their family doctors, may need to talk to their healthcare providers to see if the vaccine is right for them. In most cases, in my understanding, the benefits of vaccine far outweigh the risks, and that recommendation might be, in fact, to get the vaccine. But that's why there's no blanket recommendation for people with certain comorbidities. An example of that could be people with bleeding disorders, or people who are taking anticoagulant medications.
Thank you, Dr. Ogleza. Our next question is for Dr. Guan. Hello, Dr. Guan. How are you today?
Doing well, thank you.
It's sort of a follow-up question from Dr. Ogleza's question. Were people of different races and ethnicities included in the clinical trials?
Yes, people of different races and ethnicities were included in the clinical trials. Approximately 42% of global participants and 30% of US participants had racially and ethnically diverse backgrounds, and about 41% of global and trial sites were located in 6 different countries, including the US, Germany, Turkey, South Africa, Brazil, and Argentina. So based off this, we're pretty certain that it is quite effective across a variety of different ethnicities.
And were there people of different age groups, like older adults, included in the clinical trials?
Yes, there were. So about 41% of global and 45% of US participants were 56 to 85 years of age. The observed efficacy in adults over 65 years of age was over 94%. So this is a very high efficacy in a population of our most vulnerable folks in our communities. Unfortunately, nobody under 16 years of age was included, and therefore at this current time are not advised to receive vaccine. However, there are ongoing studies and trials looking at folks who are younger.
Thank you, Dr. Kwan. Our next question is for Dr. Ogleza. Can people who have been diagnosed with COVID-19 be vaccinated?
Yes, definitely. Those who have previously had confirmed COVID-19 infection should still get vaccinated. And the reason for that is that we know that there is some naturally occurring immunity following COVID-19 infection, but we don't know how long that immunity lasts. And given the severe nature of some of the risk associated with COVID-19 infection, it is still beneficial that that individual get the vaccine. The reinfection is possible, and the vaccine will provide that additional protection. Now, at this point, we don't know how long the immunity from the vaccine will last, and again, that's something that will become known as there's more clinical information from trials and from data gathering that we have. But again, individuals with prior COVID-19 infection should still get immunized. A similar question to this one that also comes up in my discussions with the community is whether someone who had COVID-19 immunization could still have developed COVID-19 infection. And the answer to that question is yes. Again, vaccine is very, very effective. We've seen in trials it's over 90% efficacy, so it is a very effective vaccine. But it is also possible that someone, while they are getting their COVID-19 immunization, they might have been exposed to that virus just days prior. And it takes about 2 weeks to develop, up to 2 weeks to develop infection from that exposure. And vaccine, unfortunately, it's not what we call a post-exposure prophylaxis. So if someone already been exposed to the virus, even though they may receive the vaccine the next day, they will still they could still potentially get the infection from that initial exposure to the virus. So that's something that's important to keep in mind as well.
Thank you again, Dr. Ogleza. Our last question for today is for Dr. Guan. How was Health Canada able to approve the COVID-19 vaccine so quickly? And did they lower their safety standards for vaccines?
So that is a question that comes up in the community, but I can assure folks that Health Canada did not lower their safety standard for vaccines. The reason that the COVID-19 vaccine was approved quickly is not because safety standards were changed. It's because Health Canada shortened the administrative and organizational process of vaccine authorization through much quicker meetings between the different steps, as well as parallel steps, all at the same time. So, for example, instead of waiting a month between different steps, they waited a day or days between the different steps. The safety requirements in clinical trials for COVID-19 vaccine were just as strict as the regular process for any other vaccine.
Thank you very much, Dr. Guan. So that concludes all of our questions from the public so far about the COVID-19 vaccine. I want to thank everyone for joining the call and helping our community understand many questions that are out there about the COVID-19 vaccine. And thank you for answering. We hope that this will help comfort people that may have anxiety around the vaccine. And of course, we're always willing to take more questions at all 3 public health units, and we look forward to your questions. Thank you again.